We're really excited to be here today. We have a very special guest that's going to give us an opportunity to have a conversation and learn about a lot about some opportunities. I'm really excited to welcome Dr. Streeter, who's the director of the partnerships at the Stanford Institute for Economic Policy Research at Stanford University. Now, Dr. Streeter works with external partners to engage the Institute's community of faculty, visitors, students, and supporters in pressing economic policy issues. She also helps strengthen ties with government and policy organizations to facilitate cutting-edge research across the Institute's focal areas. We're really excited to have her in this discussion today because her research primarily focuses on the economics of aging, retirement, security and financial security, and mental well-being of older adults. We know a large part of our population that we serve on a constant basis is those individuals that are beginning to age. And really, our concern is always about the economic ability of them to be able to have a quality of life. So now most of her work is empirical and utilizes a large amount of macroeconomic data. Now, prior to joining the Institute, she was a research scholar at the Stanford Center on Longevity and an economics professor at Allegheny College. Now, Dr. Streeter completed her PhD in economics at Indiana University, Bloomington. And in her spare time, I hear that you're an avid piano player. So I don't think we'll get any piano playing today, but that would also be amazing. But welcome, Dr. Streeter. We're just really, really excited to have you. And thanks for giving your time today to come on and share all the knowledge and all the information that you have. It's really valuable for us and our complete network. So welcome.
Thank you, David. Thank you, Tom. Thank you so much for inviting me. And it's great to be here with you today. So probably I'll just start sharing my screen because I've got a lot of presentation slides ready. So I'll go ahead and do that. All right, you can see my, probably I have to do right here. Can you see it? Okay, all right. So great to be here. Just want to talk about homelessness in California today. I have probably 20 to 25 minutes, so I'll try to go quickly. All right, so first of all, let's just look at what is the magnitude of homelessness in California. So California has the largest homeless population in the US. So we can see in 2020, it's about over 160,000 homeless individuals in California. And that number, I believe, is rising now based on the most recent data that I didn't put in this visualization. And another thing that's very alarming is the speed of growth. So we can see in other states such as New York, Florida, Texas, the homelessness rates, this is per capita, they're probably rising, like in New York, they're rising, but they're plateaued in recent years. In Florida and Texas, they're basically declining or flat. And if we look at California, separately and the rest of the US as one other group, then we can see in California between 2014 and 2020, homelessness rose by 42%. And all other states together as a group had a 9% decrease. So pretty much all the increase happened in California right here. And this is a good example of how we are facing a very challenging issue. So in the LA County, every day, 227 people become homeless, and 207 people they find housing, so they exit homelessness. And so that means homelessness increases by 20% per day in the LA County. And if you multiply that by 365 days, we have a net increase of 7,300 persons per year in the LA County alone, okay? So we have this perpetual increase of homelessness in California. Some unique characteristics of California's homelessness, if we compare it with other states. So here we can see that California, I have aligned all the states on the horizontal axis. You can see California has the highest unsheltered homelessness. So that means people who live in cars or in tents, in encampments, in parks, on the street, on sidewalks. And on the other hand, we know that New York also has a high homeless population, but their unsheltered is only about 5%. So 95% of New York's homeless are living in a shelter. And something else that's really interesting is California has a very high percent of single male homeless population. And so we can see that 65% of them are male compared to other states are all smaller. And 84% of California's homeless are not with a family. And so what are some of the key considerations of homelessness in California? So I listed 5 factors. I believe there are many, many other factors, but these are the 5 factors I believe to be the most important. One, high housing costs. We all know it costs $2,000, $3,000 to rent a 2-bedroom apartment in major California cities. It's very unaffordable. And also housing shortage caused by some outdated regulations such as CEQA. So that makes it very difficult and it's very difficult and it takes a long time and it's very expensive to build housing. And the third is a lack of shelters, and which I will dive into in detail momentarily. Fourth one is the lack of mental health and drug addiction treatments. And I'll also show that in detail. And the last one is crime and safety, and then somewhat related to the passing of Proposition 47 in 2014. So today, due to time constraints, I will focus on the third and the fourth factors, basically a lack of shelters and a lack of treatments. So a lack of shelters. So we can see in California, this is from 2007 all the way to 2020. And the red bar represents the number of unsheltered homeless. The blue represents the number of sheltered homeless. You can see over time, the sheltered individuals stay flat. So all the increase in homelessness happens among the unsheltered. And then the same thing happens if you look at cities, for example, San Francisco. Again, the red represents unsheltered individuals, the blue represents sheltered. So you can see the shelter is pretty much the same. And the red one, the unsheltered homeless has increased, has doubled over 15 years. Same thing happened in Oakland. The unsheltered tripled actually in this case from about 2,000 to now 7,000. Same thing in the LA County, 3 in 4 homeless individuals are unsheltered. Okay, so the natural question next is why is the share of unsheltered homeless so high, right? And the simple question, the simple answer is we don't have enough shelters. And so just take San Francisco, for example, between 2004 and 2014. So I'm not plotting 2004 here, but it's like you can see it's right here. So between 2004 and 2014, there was something called a 10-year plan in San Francisco. It was under Gavin Newsom, who at the time was the mayor of San Francisco. So under his leadership, they pushed forward something called San Francisco's 10-year plan to eliminate homelessness. And then they decided we're not going to build more shelters, and instead we're going to build more permanent supportive housing. And you can see the shelters basically stay flat. And after 2014, after the change of leadership, and then they also realized, hey, you know, this 10-year plan hasn't worked because homelessness has gotten worse. So they restarted building shelters after 2014. And so that's just, this is a perfect example to show how we're not building enough shelters. And then this problem has been with us for a long time. And now we started to see the problem. And so when you don't have enough shelters, it's not just people who are suffering on the street. It's not just the business who are suffering as well, but also there's law that permits homeless encampments, because you can see here, they specifically ruled the law enforcement, they're not allowed to force people off the street, off public property overnight if there's no overnight shelter available. And so the natural question is, if not enough shelters were being built, then where did the money go, right? We spent billions of dollars on solving the homeless challenge. And so here I can show you some data, what we've been doing in California. So we can see Emergency shelters, transitional housing, those are all being relatively flat, especially between 2007, 2014, that period, as I showed you. But compared to that, the permanent supportive housing has risen very fast, whether you're looking at California or San Francisco or LA. So permanent supportive housing has increased a lot over time, while emergency shelters and transitional housing has been flat. So what is permanent supportive housing? It's basically just an apartment unit provided to homeless persons with they call wraparound services. So what does wraparound services mean? So it could be drug addiction treatment, it could be mental health counseling, and those kind of wraparound services to help the homeless individuals. So that look really great on paper, right? There's one feature that those wraparound services, they're offered to the homeless clients, but they're not required. So for someone who is living in the permanent supportive housing, suppose he or she has drug addiction problems, they can reject participating in those treatments. And then nobody can say you must participate. So that's one key feature. And another thing is, we know it's very difficult to build housing in California, whether you're looking at low-income housing, whether you're looking at permanent supportive housing, it's just expensive and it takes forever. So here's some example. So we all know Proposition HHH in the LA County. It cost about $1.2 billion. It was passed in 2016. So it was 6 years ago, right? And so according to the LA Controller's report, it takes about 3 to 6 years to build a permanent supportive housing. And so far, 5 years later, they have only finished 1,142 units. So that doors, okay, that's like, one apartment. The one unit means one apartment. And each apartment unit cost about $600,000. So if you look at, that's the price tag, and then that's how long it takes. No wonder, it's very, very challenging. As I said, it's very challenging. It's very expensive to build this permanent supportive housing. Okay. And so as an economist, we often think about, okay, what is the opportunity cost of building permanent supportive housing? Permanent supportive housing is great. I'm not against it. It has its virtue. It's nice. It's permanent. And people are indoor. It's great. But we also have to think about the opportunity cost of permanent supportive housing. So here, this is the data from Bay Area Council Economic Institute. So they looked at the cost of all other types of housing. So for example, cabin community, shelter beds, they're much, much cheaper than the last one, permanent supportive housing, right? It's like $500,000 to $600,000 per unit. And so here I just want to show you some pictures of those are cabin communities or congregate shelters or non-congregate shelters. This one in Mountain View is run by Life Moves. It's a nonprofit organization. They operate in the Bay Area. They operate non-congregate shelters. I actually have gone there. I interviewed their director. It's very nice. It's very clean, tidy, and well organized. People there, they're very happy there. So I highly recommend everyone to check out Life Moves website. All right, so that's the first part, as I already told you, a lack of shelters. And second part, I want to talk about the difficulty in accessing mental health and drug addiction treatments. So we know that California has a high percent of chronically homeless. So what does chronically homeless mean? So that means people who are homeless for more than 1 year. And also they usually have some kind of disability, whether it's mental disability or physical disability, okay? So compared to all other states, California has a very high percent of chronically homeless. And then they're the most severe homeless, and they're the most difficult to house, okay? And why is that? Well, the challenge here, as you can see, when you have 1/3 of the homeless individuals being chronically homeless, the challenge is a high percent of them, 80%, of this yellow share. So 80% of this yellow share, they have severe mental illness and or drug addiction problems. So those are the ones that we probably encounter when you go to San Francisco, when you go to LA County, when you walk on the street, you encounter someone homeless, and then there are just visibly homeless, and then that's probably in this red share, in this red pie. All right, so that's the challenge. Well, the problem is many of those people with severe mental illness and or drug addiction issues, they are not receiving proper care. That's the problem, okay? And so why are they not receiving proper care? Well, part of the issue is the deinstitutionalization happened in the US. It started in the 50s and 60s. In 1963, for example, President John F. Kennedy signed the Community Mental Health Act into law. So the goal at the time was the public mental hospitals were inhumane, which was true. And they were not treating patients with respect and dignity. And so the goal was to replace the inhumane public institutional care with community care. And also at the time in 1955, there was a new drug that was discovered to treat mental illnesses. So the two things together were saying, well, let's just close down public mental hospitals and then treat them in the community so they can, so the mental illness patients mental health patients, they can re-engage in the society. And you can see per capita, the number of inpatients in public mental hospitals dropped from about 330, I believe, about 330 per 100K population to 11 per 100K population. Okay, so that's in public mental hospitals. And you might say, well, okay, so now we're building more psychiatric beds in the community. What about that? All right, so I add up everything. Even if I add up all other beds, including everything you can find in private hospitals, general hospitals, anywhere with psychiatric bed, you add them all up, you still get only 170,000. So that is not making up at all from the need. And in 1955, we had 550,000 people receiving mental health treatment. And now we only have 170,000 beds in the country. So we know that mental illnesses haven't gone away. And where are the patients then? If they're not receiving care, where are the patients? Here, as I said, I interviewed a lot of stakeholders, and here I just put two short clips. It's about three minutes. I want to show it to you. So there were two doctors. One, Susan Pertovi, she is so-called a street doctor. She has an MD, but she's just really nice, and then she wants to help the people in the LA County. And then she's in Skid Row, and she's always treating people who are homeless with mental illness and drug addiction. And so she represents doctors from the Southern California area. And that Dr. Cheryl Ho, she is in the Bay Area, and then she knows a lot about the mental health and drug addiction problems in the Bay Area among the homeless population. So I just want to show to you what they think about these barriers, high barriers for homeless to access proper treatment. Okay, I think I need to do that. Let me have to.
So those with severe mental illness, the super dupers who don't think anything is wrong, they don't want treatment because they don't think anything is wrong. And then when they do want help, where do you go? To the emergency room? What are they going to do? They're going to start you on an antipsychotic? No, that's not what they do. Say there's a psychiatric emergency room. Are they going to start you on an antipsychotic? Probably not, because they don't know you, they don't know what's going on, like a one-time visit. Are they going to refer you to the Department of Mental Health? Yeah. When is your, how do you get there? Well, it's a walk-in visit. You go to Department of Mental Health clinic, you do a walk-in visit, and they do an intake. The intake takes 3 hours. No one has that. First of all, they're waiting 3 hours. So nobody, if you're severely mentally ill, you don't have that patience. You don't have that ability to say, oh, this is going to be good for me in the long run. And so, and then to get a psychiatrist takes another 3 months. Like,
the biggest need is the need for same day access to treatment. So basically treatment available the day you need it at the time you need it. Santa Clara County is home to millions of people, right? San Jose itself is about 1 million people. And you think about all those other ones and you have one place. And when I say number of detox beds, I don't know the number of detox beds in there, but I want to say it's around 10. And I think the other place that you can go detox is for women, which is Mariposa. And I believe that the number of detox beds they have is under 10. And so you think about the county our size, and you think about the number of detox beds we have, and it is just not enough. And my understanding that I've heard is that there are residential beds available, but not enough detox beds to allow for folks to go into residential. So step one, so let's just look at that part. Step one, you call it 100 number. Okay, so tell me, what could be some problems for folks that are experiencing homelessness? Well, you may don't have a phone, right? So step two, say you have a phone. As soon as you get on the phone, sometimes there's a hold time, there's wait time. And if there's not, you get somebody, then you start doing an intake. And I've actually, because my patients notoriously have historically had a super hard time getting into programs that they need to get into, I will often use my time as a doctor sitting there in the exam room. So instead of doing my regular doctorly stuff, I will sit in the exam room on the phone with them waiting. And so often I'll be privy to some of the information that I see happening. And so, they get transferred or, and so sometimes people get dropped in the middle of transfer. I've had that happen a few times where I've had to call back and then you've got to start right over again. And then you get transferred and then you give all your information to the second person and then they transfer you again to the third person. And so often there's a lot of transferring. And at the end of the day, you're then said, okay, we are going to sign you up for this residential program. This is the phone number for this program. Go ahead and call and see if they have an availability. And so they go ahead and call. And of course, there is no availability at the day they ask. And so they're told to call back. And my understanding is that you were supposed to call back once a day until you get in. And, or sometimes people will call you. They'll say, okay, or, I've had situations where, we've had people been told that, okay, so-and-so will call you. And, you get a call on your phone and then, they happen to miss it. I miss a lot of calls sometimes. And then when they missed it, they're screwed because that's it.
Okay, so, let me go back.
I've been getting paid $1,000 a month, if not more, just from this app on my phone.
Okay, let me just close where that is. I don't even know where that is. Hold on just a second. All right. All right, sorry about that. So that was like YouTube just automatically trying to show the next video. All right, so I think I probably need 5 more minutes. Should I stop or should I continue?
No, please keep going. Yeah, this is great.
Okay, so yeah, I probably just went a little too slow just now. Yeah, like let me go back to this. All right, so the last part I want to just share with you quickly is a lot of people are asking the question, how is the money spent, right? We know billions of dollars have been spent and will be spent in California. So according to the California State Auditor's report from 2021, there are about, actually there's not about, it's like at least 9 California agencies administer 41 programs to spend $13 billion. And so there are a lot of duplication according to the report. There are a lot of duplication and a lot of confusion. Who is in charge of doing what? And take San Francisco, for example, San Francisco Department of Homelessness and Supportive Housing. So in 2019, their budget, before 2019 and including 2019, the budget was about $300 million. And during COVID, they got a big chunk of COVID relief. So that's not normal. But after COVID, it comes down to about 668 million. And so I interviewed their directors, and then so they told me after COVID, from now on, you can expect every year is going to be, the budget is going to be about 700 million. So that's roughly the ballpark. Now, how is that money spent, right? So, 668 million, that's a lot of money. And if you look at their budget on the website, official website, you can see only about 21% is spent on shelters and 60% is spent on housing. So that's what I was talking about, the permanent supportive housing. And, and then some others on small programs. And so you can see we are spending a lot of money on housing, which in California, unfortunately, it just takes too long. It's too expensive to build. And then at the cost of that, because of that, we are not spending enough to build shelters to provide immediate care to people on the street who need services, who need care, who need treatment. All right, so public opinions here, according to a survey conducted by the San Francisco Chamber of Commerce, about 88% of residents in San Francisco said homelessness has gotten worse in recent years, and 70% said the quality of life has declined in recent years. And similarly, another survey conducted by UC Berkeley in 2022, and according to their survey, 70% of residents in LA and in the Bay Area said that crime has increased in 2021. Okay, and so we know that we all hear about the out migration, right? So we can see from the data that more people are leaving California than moving in. So here is the net migration, which is the difference between moving out minus moving in. So the net migration is now negative. And you might say, well, that's because of now work from home, right? So maybe there's a factor of that. But I think there are also factors of people concerned about public safety, concerned about crime, concerned about homelessness in their neighborhood. So I just want to quickly give you some links of what we did in Stanford. So at Stanford Institute for Economic Policy Research, we did a policy forum on May 19th, and we released a policy brief and also a documentary. So here on the right upper corner, that's the downloading link to the policy brief. And here at the lower left corner, this QR code is linking to our documentary, which we're very grateful it has received over 200,000 views on YouTube over 1 month. And I also interviewed, so this documentary is based on my interview of 33 stakeholders. So these are all of them, the list of their names. And so you can see the last one, the Dr. Cheryl Hall was also, I just showed you a clip of hers. And so these are some photos from our policy forum day, which was a huge success. So that's all. Thank you so much for inviting me, and I look forward to your questions and comments.
Thank you. That was great. So before we hop in, I want to open up the floor. If you've got questions, please just use the reaction button or raise your hand, and we'll have an opportunity, to ask those questions and have those conversations. While we wait on that, I'll jump right in if we can. So one of the things that we see is a constant issue is because the problem has gotten, the issue has gotten so large that, a lot of our agencies are tasked with, helping overcome some of those homeless issues in their local communities. But we also know that an ounce of prevention is worth a pound of reaction in this sense. And so do you see a lot of that in an essence where it's, if we look at the bulk of the homeless population, that California is or is not investing in preventive measures, so there's ideas to, more early education, early childhood education, more opportunities to those treatment things way beforehand, more opportunities to job training programs, those type of things that help keep people busy and help give them an opportunity to be successful in California. Have you guys been able to study any of that and look at that and see if there's any results from that end of it versus, on this side with the reaction and all the money?
Yeah. Yes, that's a really good question. So I know in UCLA, they have a California Policy Lab. And the director, Jenny Roundtree, has told me they did some research studying the effectiveness of exactly what you said, the preventative programs. And so they use data science algorithm to identify who might be at a high risk of becoming homeless before they become homeless. And then they reach out to that person and say, hey, like, do you need help? Maybe we can provide you some either financial help or other kind of assistance. So yeah, so far I've heard positive feedback about that program. And I do think it's important to prevent people from sleeping on the street. First of all, I think sleeping on the street for a month, it's going to change your physical health, your mental health. It's going to make it a lot harder for the person to go back to housing.
Yeah, absolutely. Are there other questions? Yeah, Jacqueline Disney, I see your hand raised.
Hi out there. Thank you for having this forum today. I was a little bit late coming in, but I just wanted to say I really appreciate the facts that you tied in together. A lot of times you don't see the tie between the deinstitutionalization plus the access to medical care, plus the cost to develop housing in California, especially. I mean, that just exacerbates the issue. And I think we tend to think in silos of either we think of it from the hospitalization perspective, or we think of it from the housing development perspective, and really it all ties in together. So I like seeing that cross section in your presentation. And I think one of the biggest challenges, especially in rural Northern California, is when you're looking at building permanent supportive housing, because that's what's going to get people off the street, and you're addressing that population that's hard to house. It's one thing to break it off into your subpopulations that are easy to find housing for if you can kind of organize that way. But at the end of the day, it's that permanent supportive housing group that, how do you address that? And creating that, especially in smaller communities where there's capacity issues, you need to find an organization that, first of all, can build your shelter communities, and then someone who can actually run the supportive services to that community. And that's really hard. And I'm not really sure if we have an answer today, but if at a statewide level, they've considered that, like, how do you either capacity build or find a statewide organization that can provide that kind of permanent services, permanent supportive housing services in some of these more remote communities?
Yeah, I think that's a really good comment. And thank you so much for your compliment earlier. So yeah, I've talked with someone who manages a permanent supportive housing site. And one of her concerns was when one of her homeless clients have a psychosis episode, she would call someone, because she's not a doctor, her staff they're not doctors. She would call the county, and the county would assess the problem. And if the problem is not severe enough, they wouldn't send anyone out. And therefore that patient, it's heartbreaking for her to watch that person just collapsing and becoming really severely mentally ill over time. And then the county will send someone out, but then it's too late. You could have done something much easier at the earlier time. And so, yeah, I'm not aware of anything that's at a state level, although I have heard of the care court, which is being right now discussed. So I don't know where that is going to go, whether that's going to be effective and cost effective and efficient.
Yep.
Thank you.
Thank you. No, it's that gap is a real problem between where you have the service level provider, and then you have at the county level, they really see, everyone's limited on resources as far as their personnel. And so they assess at what level are they going to respond? And usually your county level government is going to respond when you reach like, okay, has it escalated to that point? And then you've got a severity issue. And so you have this person who's caught in the gap where there's no organization right now that's in place that can catch that, where they've exceeded the capacity of where the service provider, but they haven't quite met that level of intervention by any at the county level. And I don't know what the answer is for that either, but I think that just kind of further exacerbates that problem for permanent supportive housing model.
Yeah, I think that goes hand in hand with what the two doctors earlier in my presentation talking about the lack of access to proper treatment, whether it's mental health treatment or drug addiction treatment.
Mm-hmm.
And on that conversation, is the lack of access because there's not positions or there's not people to fill those positions? Do we just not have enough clinical social workers? Do we not just have enough psychiatric, folks?
There are not, both. There are not enough psychiatric beds,
Okay.
and there are not enough mental health workers.
Okay.
So I think there was a new legislation last year was like trying to encourage more people to go in the mental health services sector. But yeah, it's going to. I mean, it took more than half a century for this whole issue to unfold. So it's going to take a long time for it to close that gap.
Mary Alice, I see you came on. Did you have a comment?
Yeah, I just want to certainly echo what Jacqueline said. Thank you for providing a foundation as to understanding why we're at where we need to be at. We're at now with homelessness. And we're experiencing that now. And we're in the midst of building a low navigation center, and which, thank God, we're on land that is by right because of the legislation. But typically when you're trying to build something, also you have the NIMBY that comes out. Nobody wants it in their neighborhood. And you have to be in town for people to access services because that's what's going to make it successful. And I guess for me, I think one of the things is I feel like we understand the needs and the cross sections and the complexity, but I almost feel like we need a room full of legislators in the room to understand all of these pieces that you put together. And this, we can bring all the people that are doing the work and are seeing it. And we have permanent supportive housing programs now, and we see this now. We are actually the leaser. We lease it on behalf of our participants because they won't lease it to them. And we have the psychosis that happen, and our staff are not psychiatric workers, but we can get them access. We're in a rural area. In some ways, for California, we're smaller, and I guess it's frustrating. And I appreciate the doctor because we do that as well. We're making the phone calls on behalf of our participants. And I guess I'm like David, I'm like, what do we need to do? Is it getting legislators in a room together who are making policy with other folks together to talk about a symposium? I don't know, because we can't keep throwing money at something because it's not working.
Yeah, I mean, I don't know the long-term solution. I do hear some, just individual solution or a little idea from here or there, just to sort of like patch the problem. And the one idea I heard from someone from Life Moves. So they basically, Life Moves is, as I said earlier, so they're a nonprofit organization running homelessness shelters in the Bay Area. And they have a new shelter in Mountain View that I visited. So they told me they have the same issue. When they call the county, nobody would come out, right? Because there's a shortage of counselors. So they decided to partner with local universities, including community colleges. And then they partner with universities so that they would send graduate students who plan to go into becoming a psychiatrist or becoming a healthcare workers. And then so they have some knowledge, and then they also have the compassion to help the homeless. And so they basically get a lot of students on site when they couldn't get counselors. So I'm not sure whether that's going to help your problem.
No, and that's some of the things that we're doing now with the wraparound we're going to be doing. We're going to have the county mental health at our site. They're going to have staff there. We have the hospital there and then the local clinic that has connected to a medical school. So they have rotation of students. And we see that as well. And I mean, we're small enough. Our county is about 400,000. So we can really wrap our arms around it. But ultimately, it's going to come down to policy and
Yeah.
money to fulfill those policies.
Yeah.
And I think we can do everything we can. But I guess for me is unless you have something that, like you said, it's real policy and legislation, it's not going to continue. You know, what happens if I leave? What happens if some of the partners lose funding? It's
Yeah.
all based on funding.
Yes, yeah, there is money, substantial amount of money available. So in 2004, you guys probably know this Mental Health Services Act, also called Proposition 63, was passed to levy 1% income tax on the millionaires in California. So that money was supposed to help people suffering from mental health problems. But right now, a lot of counties are sitting on the reserves of money and not using that money effectively. So I think that's probably one area we could examine.
Thank you.
Thank you. Hi, Tom.
Tom?
Hey, I'm glad you brought up Harris Court. I'm not sure where that's going to go. I mean, I listened to the Assembly Judiciary Committee hearing on it. I mean, I think it will get to the governor's desk. I don't know, financially what that's going to cost cities and counties. And I think a lot of legislators would have preferred to have seen it as a pilot project. So, I mean, I'm glad you at least raised the issue. I mean, I spent 2.5 years in San Francisco, right by City Hall. And the one thing I realized with shelters is that, especially if you're drug addiction, mentally ill, shelters have a lot of rules. Can't bring the dog, can't bring all your stuff, got to be in at 6, got to be out by 8. And if you're mentally ill, you don't like a lot of structure, as you were sort of referring to. I mean, where you're being told to be put in a box and you would just prefer to be out and not deal with that. And so I think shelters, I think people have some illusion about how that works, but in reality, I don't think it really does. It's the same as we've talked about. This state is obsessed with housing, permanent housing at $600,000 per unit. And the money is just not there. And CEQA is, I know you didn't get into it, but I mean, before you can even get a shovel in the ground in this state, you're probably looking at $200,000 alone. But our state legislature seems to be obsessed with housing. I saw that you had talked to Jason Elliott in the governor's office, who, is honestly an interesting guy because he's been the chief of staff to 3 San Francisco mayors. And he is the governor's point guy on homelessness. I'd be interested, if he gave you some thoughts as to where, I mean, is there going to be change in direction? Because my fear is when these surpluses are gone, and they will be gone, and there's no more federal CARES money, and there's no ARPA, this state is really going to get into a rugged road in 2 to 3 years. I mean, I don't know what your thoughts are just as an economist.
Yeah.
If you were to look into the future where, you see it really getting worse.
Right. Yeah, I totally share your concerns. So 2 things on shelters. I totally get it that the traditional congregate shelters are nasty. They are, not safe. I've heard from people who are homeless who have lived in there. They're not safe. They have lots of rules, no pets. You cannot bring your girlfriends or your relatives. And I think the solution to that is not immediately, let's just build housing to solve all the problems. And I think we can look at other options such as non-congregate shelters. So the Life Moves shelters that I visited in Mountain View, they are non-congregate shelters, meaning each person has their own private space. You have your own key to a room. It's like a studio room. You don't have a kitchen. The kitchen and bathroom, those are shared. And then they also have family areas where they have a bigger space. They even have a playground for the children. So I feel that is a sort of both a cost-effective and it solved some of the unpleasantness of congregate shelters in the past. So when I talked with Jason Elliott, he also pointed out that the future is, I mean, not all the future, but part of the future is in non-congregate shelters. And I think he was talking about the hotel conversion that he was that was under his leadership. And then I think even that hotel conversion is cheaper than building permanent supportive housing from scratch. And then that's point one. Point two is on housing. I think you're right. California is all about housing. And I think that's not, I mean, based on all my conversations with policymakers and policy insiders, I don't think that's going to change anytime soon. I think the politicians, they love to talk about housing because, their constituencies like to talk about housing. And the nonprofits like to talk about housing because they've been in this area for all their career. So if I were in that area all my career, I wouldn't want to just quit and do something else, right? So that's that. So yeah, I definitely also share your concern about right now, California has this budget surplus, but it can be transitory, right? It can be gone before we know it. So how can we use it to solve the biggest issue? The problem is homelessness is such a big issue. I think that the surplus is probably not even enough, and not along, how we wasted on many things.
Yeah.
Yeah.
And I also want to acknowledge that Helen had a comment in the chat, just
Oh, sorry.
following up on the CARES courts, and just, kind of bringing it to the issue. And Tom, I know you've mentioned this, and it's an unfunded mandate is going to be the concern. We're going to mandate this, but without funding to do that. So now may be the time to bring people together and say, yes, while we concur that we need to have a better systematic approach to working with people as such, it goes back to the same thing. Are we funding enough mental health professionals to be there at this time and looking at that long game? So I just want to acknowledge that comment is there. So Helen, we concur. I don't know if you want to say anything else on it, but
yeah, I mean, I totally, I feel everybody's talking about the CARES court and in a hopeful way. But I think in essence, it reminds me of Laura's law. There might be some differences here and there, but I feel, maybe, I don't know how we're going to address the fundamental problems. If somebody is sleeping on the street, who is going to petition this person receiving treatment? And if he or she does not have a family member doing that petition, can the policeman do that? Can the social worker do that? I don't know. I think those issues need to be discussed.
yeah, one last thing I want to add, I don't know if there's any other last minute comments, but our network, as we were saying before we came on, is a big part of ours is around prevention and all the programs that we offer, just try to move the needle so that we have less people coming into homelessness. We find that being able to work with our families and their children and the whole family unit structure way before we get to this issue has been a lot, more beneficial. And that whatever, type of conversation that comes out, we have to really continue to mention that aspect, that all these other programs that are out there, really do help prevention. And one of the things we argue is that when you make lengthy policy on programs, when you make lengthy application systems, as we saw with emergency rental assistance, you had an adverse effect to that. You're really, a delay in payments that we've had, the issues with the long application process without, funding folks to be on the ground to help administer those applications. At the end of the day, more people became homeless because of that. You've got people out there now that still don't have rents paid. And so when those things, we could fix those things really easily by having a better understanding of policy development. I mean, you're the economics, so you would know, you could see it, it's just at that point it becomes a numbers game. And so hopefully you'll join us in advocating for that. We just got to try to keep it simple sometimes so that we don't overcomplicate things and create even more burden on our local agencies and local communities. So,
I mean, if I may just bring up one more point, I forgot to mention it earlier. So as part of my interview series, I talked with someone named Alan Graham. He's a director, founder and director of an organization called Mobile Loafers and Fishes in Texas, in Austin, Texas. So he is also a non-congregate shelter community. And one thing that strikes me most is his community, everybody works. And he told me the importance of working. It really gave all the homeless clients there a sense of individual agency. So they feel they are responsible for their own life, and then they regain that confidence, that individual agency back, which they lost during the time when they were homeless. So I think that was a unique approach that I haven't seen elsewhere in California.
Yeah, we concur. We had a kind of a village right outside of our office in Sacramento. One of the things that we noticed really quick with them is they had a very organized approach to the way to that community. You know, they have a community within themselves, and everyone had a job to do. Everyone had a responsibility to help keep that community, clean and safe. I know we'd go over and try to donate items, and Tom can tell you about it. They said, no, that's, you drop this off here, we do this. It's just really amazing because we all want that sense of community. And to give the opportunity for folks to do that is very, very vital. So I'm glad you mentioned that. So
I know just for us, that's some of the things that we are integrating with our project, because it is a low barrier shelter. So it's not just, Tom, there is two kind of phases. There's one that is a shelter and a low barrier where you're meeting people where they're at, where we do have their pets that will be with them and recognizing those things, plus jobs, because we have the litter abatement. So we're working with another group for the transitional housing that is using that Austin model that is going to create that. So looking at them coming from our spot to going to that spot. And I think for us is helping to stabilize the lives at least, and that they would be with us the entire day. They don't leave. So this isn't like someplace comes to eat or they just sleep there and they leave. No, they would actually be there the entire time if they want to. We don't have to they don't make them, and they don't have to access services. But I think the intent is they already know us because they're working with us now with the litter abatement programs through Caltrans and some other things. So they're earning income, and we're seeing the changes already. They're getting hired. They're getting hired by us, by Caltrans and other folks. So you're right. It has to have a work component, a piece that begins to affirm that they're human beings, that you see them. You're not looking at them or through them or ignoring them. And I think those are the pieces that are really important. And so we're trying to visit all the, so I'm glad you shared the Mountain View one, because I know we've visited that one and some other ones as well. But it's very complex, and it's going to take all kinds of heads coming together and all kinds of approaches. But I think that piece that is important is the dignity and the access.
Yeah, definitely. Totally agree.
Thank you for your time. I also want to acknowledge that Sherry put a comment in the chat. I think it's really good and wonderful to hear about a program they have, which is an apprenticeship program to address the shortage of mental health workers. So Sherry, thanks for that. That sounds like one of the major answers we need to have. So I do want us to wrap up. We're at the top of the hour here. So was there anything else that maybe we didn't mention, or a discussion we didn't have that you'd like to share?
I think that's all. I mean, I'm happy to share my slides with you guys. And so if there's anything you want to download, I mean, there's a QR code to our documentary and policy brief at the end of my slides that everybody can access.
Thank you for that. We'll definitely send them out. That's some powerful information, and a lot of the advocacy and the conversations that we have, that'll be extremely beneficial. So, well, I just want to thank you again. This has been wonderful. Thanks for leading this discussion and getting us, getting the conversation out there for us. This is really phenomenal. Tom, thanks for all the work on this to bring us together. So if we could ever be any assistance to you and any of the work that you do, we have folks all across the state that are the boots on the ground and run some major wonderful companies to help us overcome this. So thanks everyone for joining us on this Monday morning. We will see you at the next roundtable if we don't see you before that. Everyone have a great day. Thank you guys.
All right, thank you guys so much. Thank you, David. Thank you, Tom.
Take care.
Bye.